we can get started. Thank you guys so much for coming. My name is Sarah Lynn. I'm a project manager over at Millennium Collaborative Care, and my projects focus around long-term care and home health care. So I'm here to talk to you today a little bit about Interact and one specific tool in general that we'll talk about. So a little bit of what we're going to do today. I know that the screen's kind of crazy, so you might have to.
Sorry.
That's all right.
I have to keep moving it.
We're going to talk a little bit about hospitalizations quick, the Interact program, one of the new tools, and then we'll have some time for questions if you guys have any. Can I just start with what positions do we have in the room? Housekeeping? Housekeeping?
Nurse's aide.
Okay, great. Thank you so much. My background is an occupational therapist, so I've worked in rehab and a lot of different skilled nursing, so I definitely am familiar with that setting, and it's kind of where my long-term care experience lies. We all know hospitalizations, they're kind of an evil necessity, if you will. Sometimes we have no choice but to discharge our patients to get, assessed and treated. But what we're really looking at is those situations when a hospitalization could have been avoided. Or if, instead of sending them to a hospital, we can perform treatment here in the skilled nursing facility. Now, that doesn't only, benefit our patient with exposing them to less hospital-acquired infections or risk for falling or just uprooting them from their environment, but it's really good for our staff and for resources to Medicaid, Medicare, HMO dollars that are used to fund these transfers back and forth between the facilities. So we all know, especially the therapy department and nursing department, you'll get a patient back from a hospital and, they were there for a couple weeks and all of a sudden they can't walk, or, they were a little bit delirious when they were there because of the new setting and they fell and broke a hip or broke an arm, and now they have a whole nother condition on top of their initial condition. So we're really trying to, avoid any of these risk factors that happen when a person enters a hospital. Right now, the current statistics are from anywhere from 15 to 25% of patients are readmitted into a hospital within 30 days of coming to a skilled nursing facility. So that's anywhere from 1 in 6 to 1 in 4 patients that are going back to a hospital in 30 days, which is really a very high number, and we're really trying to decrease that as much as we can. Of the patients that go back to the hospital, congestive heart failure, COPD, UTI, pneumonia, and dehydration are 5 out of the 6 top factors why. Now, out of all those conditions, do you think that any of those could have been prevented or avoided? None of those are like a heart attack or, a bacterial pneumonia or something that really strikes quickly and swiftly. A lot of those things kind of occur over a period of time. There's a couple days to even a couple weeks time when you may have been able to see some signs and symptoms of a condition occurring, and that's what we're really trying to hone in on, is that time period before the patient gets so sick that they need to go to a hospital. So what do you guys have to do with this? Direct care staff, you guys are really the first line of defense for nursing homes. The thorough care that you provide to the patients, making sure that they're clean, giving them, the appropriate amount of assistance during transfers, or, making sure you're following their dietary guidelines and not giving them the wrong consistency food. For nurses, administering the correct medication at the appropriate time with the right medications. That's all important, and it helps to keep our patients safe and healthy. In addition to that, you guys are really also the first line of our offense. So you know these patients inside and out. You know their behaviors, their personalities, who they can't stand, things that they like. So you're going to notice those subtle little changes that a doctor who's here, once every couple days might not pick up on, or the relative that's here once every week isn't going to pick up on. You're here every day, in and out. You see the patients in their most vulnerable states, so you really, they're not putting on a show for you usually. You really can see what's really occurring with these patients. So it's really important that we pick up and notice these, but also that we're communicating these changes to the correct parties. It's no good if you notice things and then you're keeping it to yourself. And this isn't a conscious decision a lot of times. A lot of times we're so busy with everything that we have to do that it slips our mind until it's too late. So many times when I was a therapist, I'd come back from the weekend and a patient would be in the hospital, and you hate that feeling when you're like, oh, I could have seen that coming. Did I ever tell the nurse on Wednesday that they were having more trouble? I know I tried finding her, but she was on her lunch break, and then did I tell someone else? it's a bad feeling when you feel like you could have done something to prevent a hospitalization or prevent any sort of negative situation with one of your patients. That's really where the INTERACT program comes in. So what it is, INTERACT stands for Interventions to Reduce Acute Care Transfers. So what that is, just reducing rehospitalizations. It's a quality improvement program. It's evidence-based. It's been implemented around the country in several different states, a lot of different nursing homes. And really what the research has shown is the good implementation of this program can lead to a 25% decrease in readmissions to the hospital. So that's a quarter less patients leaving your facility and going back into the hospital, which is great. Now I should definitely say the goal of INTERACT is to improve care, not to prevent all transfers. So we are not going to be barricading the doors and nailing them shut and not letting you send anyone to the hospital ever again. That's definitely not what we're trying to do. We're trying to just prevent those hospitalizations that could have been avoided and prevented. And really, we want to prevent that decision from even having to be made. We don't want to get to the point where, like, should we send them out, should we not? We want to get to the point where, I just noticed that Mary's acting really funny and, her urine was darker. Maybe we should take a look at it. So we're trying to get to the very beginning of things where they're not really at risk for needing to go to the hospital right away. So what are the strategies, like I just said? So early identification and evaluation of symptoms, managing some of these conditions without transfer whenever it is feasible and safe, and then improving communication and documentation not only within the skilled nursing facility, but within the skilled nursing facility and the hospital as well. A lot of times, our patients suffer from our breakdown in communication, and that's a really unfortunate thing because communication, for the most part, it should be a pretty easy thing to fix. So we just need to work a little bit harder at having good communication so that our patients aren't suffering because of that. We can click forward to the Stop and Watch tool then. We have a couple other tools we're going to be talking to the nursing staff about, but the Stop and Watch form is really what affects everyone else. So this is a really good form. It's clean, it's simple. Stop and Watch is an acronym, so you can see kind of what it stands for. There's a bunch of different signs or symptoms that you might notice that you'd like to communicate to the nurse so that maybe they could take a look at that patient. And by maybe I say they definitely should. So when you're giving this form to the nurse, it means that you're concerned, you noticed a change, and then the nurse is going to take that and do an assessment. Some examples: seems different than usual, overall needs more help, new or worsening pain, no bowel movement, agitated or nervous more than usual. So this kind of encompasses the whole spectrum of different conditions, be it physical, emotional, or behavioral, that might be occurring that could be indicative of a change in condition with the resident. So all you have to do is really take this form, circle it, put the resident's name, the date and the time is important, and then your name, and then hand it to the nurse. You can change the screen. So when should you use this? You can use it at any point in your shift, whenever you feel something has changed in your resident. But you want to make sure that you're not interrupting your care or leaving the resident in a vulnerable or unsafe position to fill out a form. You always want to finish your shower or finish your transfer or whatever that you're doing with the patient to make sure that they're safe before you go fill out a form and talk to the nurse. And this form, really, you shouldn't be filling out this form and chucking it on the nursing cart and running away as fast as you can. That's not the point. This really should be used in conjunction with a conversation with the nurse. So, you don't have to sit there and talk with her for 20 minutes, but you want to, hand over the form and say specifically what you noticed, a couple sentences about your concerns and what the situation was. So, for example, when would you fill out a Stop and Watch? When Mary chose to wear her uncomfortable red heels instead of her usual sneakers to lunch? Probably not. Ethel's urine was darker than usual and had a strong smell? For sure, you should always report that. Chatty Cathy was very quiet and despondent during her favorite activity? Yeah, that's a change in behavior, a change in personality, and that can definitely, be signaling that there's something going on. Clarence tried hitting you while you were putting his clothing protector on? Maybe. What is his usual behavior? How did you approach him? Did you startle him? That's all things to think about. If you have a resident that consistently at shift change at 3 or 4 o'clock is trying to get out of their chair and trying to transfer, you wouldn't really document that because as a change, because it's their normal behavior. Whereas if you have another resident that you gotta get like the crowbar up to try and get them out of the chair, but now all of a sudden they're real antsy and trying to stand up, maybe they have a hemorrhoid, maybe they have a UTI, so that's definitely, it's a behavior change, so that could definitely be signaling that something is going on. So I know that here in this facility, the stop and watch is laminated and it's on the front of the bathroom door with a dry erase marker attached to it. So for the aides, I think that's a great tool and it can definitely be used while you're in the room and giving care. I understand for other disciplines, be it housekeeping, be it the therapy staff or the activities staff, you're not in the patient rooms that often, so maybe that would be really inconvenient for you to go and get. So we're going to try and distribute paper forms in a folder that you guys will have in each department, so that if you notice a change, you can just fill it out right there, and when you're transporting the patient back to the unit, you can bring the form with you. So that would make it a little bit, more easy and more accessible for you. So we definitely don't want to be, I know there's already a lot that everyone's doing, and adding one more thing into the mix sometimes, just makes things even more complicated. But this should be easy. It shouldn't take more than a few minutes or seconds, really, and it really won't make a difference. So, just remember, you guys really are the experts of the residents, like I said before. You know everything about these patients inside and out, so you want to put that knowledge to good use and make sure that you're doing all that you can to be a good advocate for your patients. Do you guys have any questions? Or any suggestions? No. Alright, so that's about it. Pretty painless. Thank you very much.